All right. Well, hello everyone. This is Dr. David, and I'm here with Patricia. We are going to explore a fascinating field called reflexology. And like I said, she was here last week or about 10 days ago, I think, to talk about this field, and she revealed a lot of things. There were many questions that were asked. I mean, quite frankly, I'm just incredulous. I just find it hard to believe that something seemingly as simple as touching the feet or touching certain parts of the feet can affect things like in the lungs and in the brain. So she's going to explain that, and I'm going to be right here with her. We're going to get down and dirty with this thing. All right, I'm going to read out Patricia's bio and then hand it over to her. Patricia has been an enthusiast of natural health care for over 30 years and has continued with her love of complementary therapies, gaining success as a therapist and instructor ever since. She was educated in Wales, UK, and has a deep appreciation for therapists, having high standards in education and professionalism for anyone working in the field of natural health care. Boy, that's a mouthful. She is the president and founder of Derwin Holistic Therapies, which is a wellness center and reflexology academy in Houston, Texas. She has over the years gained experience and certification in anatomy, physiology, reflexology, aromatherapy, craniosacral therapy, massage therapy, on-site massage, vitamin therapy, and herbalism. She gained a teaching certification in the UK, allowing her to instruct to university level, and has since been issued a Texas license to teach continuing education to massage therapists. She has written and presented courses in reflexology, aromatherapy, raindrop therapy, endocrine balancing, acupressure, Indian head massage, infertility, gestation, childbirth, and postpartum, some of which are taught to international level, and it is a standard that can be used in over 35 countries around the world. To date, she has over 150 therapists who have gained this international certification and who are now working in a number of states in the United States. One last line. All right, Patricia, I'm going to be handing this over to you as we speak. And I think that's it. That covers it. All right. So, Patricia, thank you so much for taking the time to do this again, and we are really looking forward to this presentation. Over to you.
Thank you, David. That was a really lovely introduction, and I'm delighted to be here again. And this time we're going to use similar slides, but we're going to go into this in more depth. We're going to have the interaction between us, which is going to be invaluable, I think, to our listeners, and we're going to be able to really show as many people as we can what reflexology is capable of doing. It is a love of mine, and I really would love it for it to get out there. Okay, my idea is that reflexology is definitely the unique technique to well-being, and I just want to talk about the opportunity that one can have in order to be able to benefit from this wonderful therapy and share with you some of the ways that it literally works. So I'm going to see what we can do about moving my slide. There you go. Okay, now this is what it actually is in a simple form. It's a science, and it is based on the principle that the reflexes in your feet and hands and, of course, other parts of your body relate to the internal organs and other structures of the body. It works on the principle that each foot has over 7,000 nerve endings, all relating to these organs and structures. It is a specific, detailed touch therapy that improves function and balance, one by stimulation, and what it's able to do then is releasing energy blockages and enabling the body to heal itself. I want to make a point about the 7,000 nerve endings under each foot. They're not random, and this is how we can work with the feet or the hands to do a reflexology session because they literally relate to the organs and structures in the body. So this is quite a unique thing that can be done with the reflexology session. We want to talk about the zones. There are 10 main zones or energy lines that run vertically through the body from the head to the toe. If we stimulate certain of these reflex points on the feet, then energy can be released and blockages are removed, enabling the body to heal itself. I want to explain that a little bit. We have a lot of imbalances in the body for reasons that you've just mentioned in your introduction, David. And so we won't always have the energy that we need in each organ or in each part of our tissue. And so it gets blocked. A reflexologist is able to detect the blockage, touch, press it, and then release that blockage so that you have the energy running through into the other organs that are blocked.
Patricia?
Yes?
When you say blockage, what exactly does that mean?
That's a good point. It actually means that there's a block of your energy going to individual organs or parts of your body. Because what happens is that we keep things like calcium and things such as that, and it stays in the body. The feet are an extremity, so they land up in the feet, and they can be felt by a reflexologist in the sense that you can feel them like little crystals. We call them little crystal deposits. The reflexologist can work on them and then move them. It is then back into the bloodstream, and what happens is then you drink a lot of water and it's flushed out. The blockage of energy is because, as you know, all functions of the body are only there because of an energy that goes into the body. Does that answer you?
Yes. So are we referring more to calcium, or we're talking about things in general, other nutrients and other?
Other things. Well, pollution, stress-related conditions, all the things that life gives us or takes from us. And so the way that the body deals with it is the way that the body becomes blocked. You mentioned earlier on about how our mind, spiritual health, and our emotions, everything is involved here. And each trauma or difficulty we may go through, there could be a block of energy.
So could that be something like when someone holds tension, when they say someone is holding tension in his neck or his shoulder, is that something similar to that?
Absolutely.
Okay, gotcha.
Absolutely the point, yes.
Gotcha.
So there's tension. You know, when somebody's tense, the shoulders are tense and the muscles are tense, and there will be a block. And then what happens is you'll find that this little part here, let me show you just to show you, this area here is going to be blocked. That there will have a callus on it. That's the shoulder area. That definitely will have a callus on it, so that the reflexologist can feel it and see it, and you work it out so that the person then is able to have relief in that particular shoulder or the neck area.
Interesting.
There isn't a doubt. It's done many times, and so many of us suffer from these conditions because of life and experiences in life, and the reflexologist is able to help it all along. You may never ever touch their shoulder, only the feet. It's difficult to believe, I know. So let's look at it like this. Each of those zones is considered to be a channel for our life energy, okay? So what we do, we stimulate to working on any of those zones, applying the pressure that we need with our fingers and thumbs, and then the entire zone throughout the body is benefiting. So now, if we can look at it like this, you know, there is a kidney area, and later on we have a chart. I'm going to be able to show you through the chart where your kidney area is. But that zone will have a block of energy that will affect the entire zone, and that would affect your eye. And then if we work on the kidney reflex, the balance of that whole zone will be experienced, and then you've got improved functioning of the whole of the organ. So we're just not random people. We're all accurately put together in a way that we can have the energy running up us in this method, in this zone. And this has been found thousands of years ago, as I mentioned in the past. Does that answer some of the questions that you have there, David?
Yes, it does.
Good. There you go. There we've got. We've come to this one. Okay, remember, these are the zones. And so here you would find the kidney area. Let me do this with pen. You have the kidney area here, the eye area here. So you're in the same longitudinal zone. That would be a block of energy. So the reflexologist is able to unblock and bring balance back into that area, and the person that receives will then feel a lot better. A lot better. Okay. So let's go on to the next one. I just wanted to talk a bit about how old it is. This isn't something that we've just decided to do in the last 50, 20, 30, 40, 50, 60, 70 years. It's an ancient science. And as today, it's becoming one of the most popular of the complementary therapies that's available. The Egyptians and Chinese and the natives of South America have all used reflexology for these thousands of years, and this picture of the hieroglyphics is showing you the Egyptians using it. And to this day, the Chinese use reflexology, the Egyptians do, Southern America and areas do it, and it's become part of their life, and they never did get enveloped in the modern medicine world that we're all in. So it's been there, and it's kept there, and you can go to any of these countries and receive a reflexology treatment, and it's quite normal to be experiencing it. Now, who else could use this work, we would think, you know? Perhaps it's just a person in the corner there, or somebody that's just got to know about it. But some of the things I think are pretty interesting is when you've got people like the British royal family very familiar with reflexology, and they have done for many years. And as you know, the newspapers follow, the press follows these people, and they want to know everything they say, think, and do. And they found in 1986, that Charles was using this strange thing, this strange cure to stay healthy. Turned out to be reflexology. And then they've got in 89, there's another newspaper mentioning that the Duchess of Kent, Duchess of York, the Queen, Princess Diana, all of them were converted into reflexology. Then,
did it say what they were converting to reflexology for? Did they have specific ailments that they saw changes in?
well, one of the things that Diana was talking about here, and it was mentioned in one of the papers, is that she had recurring back pain, and most of us know that she had bulimia. She battled with it. And so she felt that going to her reflexologist really helped her. One of the comments that was made by that newspaper was that she's walking on air since she's been getting the treatments for her aching back. And they live a grueling life. You know, they've got the public around them all the time, and they have a very heavy schedule. But the royal family, per se, all use natural health care, whether it be reflexology, aromatherapy, homeopathy, any of those things. They all readily use it and are happy with the fact that it's helped them in so many ways.
I'm sure the doctors aren't too happy about that.
Oh, I'm sure. I'm sure they're not. But having said that, you know, in some places, the doctors recognize it, and the doctors will work along with someone that works with natural health care and use reflexology with their practice. And I know one doctor that does that. He's a naturopath. He was originally a chemist, and he is influenced my life for over 30 years. His name is Jan de Vries. He talks a lot about reflexology and all the other therapies that are available in the complementary world. And he does it himself. He's in fact opened up 5 residential homes only using natural health care.
Interesting.
And now we have to think who else. So, okay, this has gone up back. I wanted to go forward. All right. Next. Okay.
Yeah, are the arrow buttons working?
I beg your pardon?
The arrows on the keyboard, are they working?
Yeah, it's going okay. It's fine. Okay. So now, who else would use that? This is just a wonderful thought to me. It really is a wonderful, wonderful thing in this country that things are starting to happen, and the centers, the treatment centers of cancer and things like this in America are now, using reflexology and integrative wellness. Memorial Sloan Kettering, I have a real soft spot for that. And it's actually mentioning that what's happening there is that they not only give the reflexology sessions to the children, but to the caregivers. And when they do that, they're doing 2 wonderful things, because with the caregivers, they obviously need the treatment because of the stress levels they're under. And we can hardly imagine what it's like to have a child with cancer then. And then to be able to use the reflexology not only for themselves but to help the children each and every day and see how they can benefit from it. It's just remarkable, when I think about that. It is a wonderful thing. And then I thought we would talk about other integrative medicine centers for cancer. And they're seeing with the research that you've got things that you've got blood pressure actually decreasing during a session. I used to do that. I used to take a client's blood pressure before a reflexology treatment and then afterwards. But by the look of my clients as they get off my chair and the way that they feel, I know their blood pressure has dropped if it was high, and so I now know by the look of them that they're absolutely in a better state than when they got on the chair.
How long does that last?
The session, the benefit?
Yeah, the benefit.
Okay, that's an excellent question because it depends on each individual. Some of my clients come and tell me that within a week they needed to come back. Now, this is when it's pretty chronic and when there's a situation there that needs really to be dealt with. And then what we do is we get people eventually to come every month in order to have a maintenance program. But when someone's left it for more than those allowed weeks that they've got for themselves, they can start to feel the difference and they say, I can't go more than 4 weeks, or I cannot go further than 3 weeks. I started to know the need to come back to you. Now, in between the time they see me, they've experienced other things in their lives too. Life is a hectic thing at this present time, and so they've been running around and looking after children and grandchildren and cars and all these kind of things. And of course, then there's an imbalance that's created in the body because of the tension. Fight or flight. We're in the fight or flight situation. So it is dependent on each person. The other thing I would like to mention here is, as each person is such an individual, I treat each person holistically as an individual within that person's thinking, personality, and all this kind of thing that you have to take into consideration when you work with someone. No one ever comes to me and has the same treatment twice because they're different people the next time they come in. Does that make sense?
It does. Thank you.
Okay, and the wonderful thing is that now we've got, Dr. Oz is pretty well known, and he's demonstrated in 2007 on the Oprah show that his work with reflexology and how it can work. And I've mentioned before that he can, in his hospital, he has his patients having a reflexology treatment before and after surgery. I can only imagine how valuable that is. And then we have Laura Norman, who I've met in London some years back, and I really go along with her work. It's a marvelous work. She's living in New York, And she works on Regis Philpin, who claims, and I know it's true because I've done it many times myself, that she spared him from a kidney stone operation. And so as far as he's concerned, she's the best thing in the world. And so we've got to look at the results to see how valuable it can be. And then there's another lady, Anne Romney, and of course she's not as much in the press as somebody like Regis Philpin, who's on air all the time, but she was diagnosed in '98 with multiple sclerosis, and she has acupuncture and reflexology on a regular basis. And I would like to just mention I've had a number of clients come to me with multiple sclerosis, and they look healthier than somebody that doesn't have any treatment. So I'm hoping this is beginning to make some sense. Now, I've also put together some of the research that was done by Barbara and Kevin Crohn's, because they are amazing reflexologists with a lot of books behind their name. And they looked at cancer studies spanning 6 countries in the world. And it's showing that cancer patients will experience significant improvement and changes in each category researched. It helps them with things that they go through. The pain, the anxiety that one would experience, nausea, vomiting, and fatigue. And you know, when one has chemotherapy, the whole experience is traumatic. And to be able to work with reflexology and rebuild that energy level along those longitudinal zones is invaluable. So these are some of the things that I thought I would just mention, and these studies that are going on throughout the world. And then again, it's talking here about pain and nausea. And it's changing in a significant and immediate way. And it helps with the quality of life. And that in itself has got to be a wonderful, wonderful thing. But to change the tone, we don't have to have experienced cancer to benefit from reflexology. Every person should experience reflexology, in my opinion. And the workplace is one of the places where it would really benefit. And then, of course, we've got family life. You know, it's a proactive part of our health program. And then if we can consider the conditions that some of the employees present with, they will be high blood pressure, allergies, diabetes, stress, migraine, and back pain. Those are just a few. When they go to work with any one of these conditions, they're not there doing their work as they should. They're just not. It's not possible. The high blood pressure will be affected a lot because they're not feeling so good, and they've got to go to work because they're afraid they lose the job if they don't go with the situation as it is. So if the employers were to use the resources to give reflexology treatments to their employees, then we would have a better presenteeism because they would all be working with much more zeal and vigor. Right. One of the biggest things we have today is stress, and how can it help? One of the things it's going to be able to do for us is it's going to relax our nervous system. Relaxing the nervous system will really ease one's tension in the spine. It will reduce headaches. Here we have the shoulder tension that we mentioned. It will ease anxiety, relax the body, and allow for focus. And then we're going to see how that can all help us with high blood pressure. So if we've got someone that's in our chair with high blood pressure, obviously we're not going to suggest they come off their medication. That would not be appropriate for a reflexologist to do. But if we work the kidney area and the adrenals and that solar plexus, which is part of the nervous system, then it can be lowered. And then we've got a person who's more effective, their concentration is enhanced, there's less body tension, they're much better as a temperament, much better, and they have less anxiety. Another major problem when it comes to employing someone is back pain, and that could be caused for a number of reasons. How can it be helped? So again, we go into the spinal area. Each vertebrae runs down the side of the foot, and it can be helped. On top of the vertebrae, we have the nerves. Underneath the vertebrae, we have the muscles. So we have a significant benefit. The fear and stress will be alleviated because that's always there with back pain. Productivity will be improved. Less people will be absent from work. They'll be more reliable, and that will help the employer too. And also, again, a pleasant temperament. Some of my successes have been things with the MD Anderson patients, infertility, childhood seizures, hip disorders, some people who have respiratory conditions, PMS, thyroid conditions, asthma, and kidney disorders. These are just a few things because we can't put everything up in one time to overwhelm someone. So this is my reflexology chart, and this is what I would consider to be a personal achievement. In this chart, I have put all the related organs of the body on that chart. And so when we look at the chart, we can significantly see where there's an imbalance in each part of our body. The situation is that if your foot hurts you, if your foot is hurting you in a certain area, by looking at the chart, you're going to be able to relate that area on the foot to something that's got an imbalance or a blocked energy in the body.
Oh, all right, Patricia, I'm looking at the chart right now. I know it's a little small on the slide, but if you don't mind going back to that picture again, that's
okay, not a problem. I'll go back.
Let's look at this.
I'll go back. Yeah.
Okay, so it looks like the lungs and the intestines have quite a representation on the sole of the foot.
Yes. And a rule of thumb would be this. If you're walking for a length of time on concrete, we were not meant to be walking on concrete for a length of time, then the underneath of one's foot could start to hurt, especially on that lung area, the ball of the foot. Well, then one would start being breathless, or it could happen the other way around. So whichever way it goes, that foot is being affected and the breathing is being affected because it's continual rubbing. Then we can look at, can you see some of the points on the chart? I think we can see some of them, although it's small. I was speaking earlier on about the kidney.
Mm-hmm.
And we will talk about it a little bit later because I was going to think about talking about kidney stones. But let's look at this. Here's your kidney. I would put my thumb in there, pull the foot over to my thumb so that I'd be working that kidney. I would definitely feel if there was an imbalance there. I'd come down the ureter, right down here, and onto the bladder right here. Now, if there is a cystitis going on or anything like that, this area that I'm on right here will be red and puffy. That's a good indication that we've got a problem with our bladder. So.
Right. Okay, one question would be, it seems from looking at the chart here that the right foot corresponds to the right eye, the right kidney, and so on and so forth. So basically, if a person has lost a foot, it's limited what you can do for the parts of the body on the opposite side. Is that what you're saying?
Well, that's a wonderful point because your body, it's all related to each side. So you've got your liver on the right foot and you've got your spleen on the left.
Mm-hmm.
We have two kidneys, obviously, and then you go around with the colon. But if someone is an amputee, then you use the hand to work and you can use the hand in order to be able to do what you would normally do on the foot. It's obviously a smaller part, but you can do it.
So all these points on the foot have their corresponding points on the hand?
Yes, exactly.
Okay.
So you can do it on the hand and you can do it on the foot. It just depends. But when you're on the foot, you can be very, very detailed. You just do tiny little caterpillar movements with your thumb and your finger, and you can literally feel all the imbalances that are going on within the body.
Now, can a person perform reflexology on herself?
You can. You can. It's better to have it from someone else, but you can do it if you were in a situation where you're in pain. For instance, if you have toothache and you're not in a position to go to the dentist, what's going to happen? I will show you again with this little pen. You're going to have redness here all along whichever tooth, and we know that the teeth all relate to different parts of the body. So you'll have redness and swollen on the toe. So what one would do is rub it, take away the pain until they're in a position to go to the dentist. So that would be an excellent example of when you can help yourself. The other way you can help yourself is with backache, and you can then work on this area here. You can work the spinal area, wherever you feel, and if you work yourself, you can feel a difference. There will be literally a difference in the touch and the feel of an imbalance that you will work down the spine.
Okay, so it can work on the spine, but can you go as far as saying that it can help realign the spine the way a chiropractor does?
Absolutely can.
Really? No way.
Oh, if you came to my class, you'd see me doing it. You can do all sorts of things with the spine. I would probably do it with some essential oils as well, which is another class that I run. And you can, if someone has a scoliosis, that spine is not going to run like that. It's not going to run down like this. It will do this. You see? Like that. That's what you'd have. It would be run, and you'd be able to feel each of the vertebrae that go down like that.
You will be able to feel each of the vertebrae on the sole of the person's foot.
On the side, yes, right here.
You will be able to feel each one, so you'll be able to tell which one is which?
Absolutely can. Absolutely. Is that amazing, isn't it? Oh, there's a lot of things that can be done with reflexology. Can assure you of that. And so that's what I would do. If somebody had a problem, and the spine, it relates to the body too. So if somebody had a condition here, in this part of the spine, and the sort of the L4, L5 around here, then I would know that there's either constipation, there's knee problems, and things like that. And sometimes I've had to do that in order to be able to help balance, because if it's a sports injury or something, then you would need to do it round here because of the imbalance in the spine. And each vertebrae relates to will bring about a condition. It depends on where the imbalance in that spine is and on each vertebrae. But I can count them as I go down the foot and know exactly which vertebrae relates to what.
Interesting.
Okay, shall we go on to the next one?
Yeah, sure.
Okay, but I'm happy to answer anything. I think I mentioned this last time too about the respiratory conditions. I think that's quite a common thing that people come into us with. You know, the pollution and stuff like that, that kind of thing. It really does affect people and everyday life. And some people have asthma, and some people have bronchitis on a regular basis, and some people have just general respiratory conditions because of allergies, you know. And then one of my favorite ones, of course, was when my mother was going to go back on a life support machine, and and she was completely unconscious. And when I went into the place where she was being nursed, I just mentioned it to the nurse that I did natural health and did reflexology. And she said, of course you can do it. They've been trying to get the mucus off her lungs all afternoon and it failed. And so I just rubbed her feet and started to cough. She started to cough, and the nurse said, oh, you've done more there in 5 minutes than this lady's done all afternoon. So I gave my mother a full reflexology treatment, although she didn't know. She was unconscious at the time. And when she recovered, she had 18 months longer, and her health was a completely different story because she had not had good health for some years. So that's one of my favorites, obviously. And then when people come, they come and use inhalers. They have other medication that they have to take in order to be able to survive their asthma or their bronchitis. And working on the nervous system again would really be of benefit here, because especially with an asthmatic, because what you're going to be doing is you're going to be working on the nervous system, and it would calm the whole system down. The whole of the system would be calmed down, and the asthma would subside. I've done it many times, and some of my clients who come to me have told me they don't use their inhaler anymore, if they do at all. Here is a little section with the respiratory system chart. This is taken off the main chart. I have all the systems taken off the main chart to help my students to get to know where each part is, which each tiny part. This area here, I'm going to use the pen again. This area here, and down in this area, if there's a bronchitis situation going on, you can be sure you can feel blockages in there. That's a given. If someone has had medication, if we rub both the top and this part together, then you're going to be able to release that anesthetic that the person has received during an operation.
How does that work, Patricia? So basically what that does, working on those parts, does it stimulate the body to certainly kick into gear and get rid of all those anesthetics? I mean,
right. Yeah, it's exactly that, because you're reconnecting the synapse is all you're doing. And then you're rebuilding those longitudinal zones we mentioned earlier, and clearing the energy pathways. One of the things I remember as a little girl of 3 in a deafblind center that I worked on, I worked in a deafblind center when I lived in Wales, and she'd had serious and major heart surgery. And I asked her mother, do you want her to come in and have a treatment with me? And she was absolutely delighted. So I worked on those lungs, and all I did was rub this area here and here in between the palms of my hands, rubbed them for her, and worked on the solar plexus here, and the little girl coughed the mucus up on the way home. Literally coughed it up. And in my mother's case, she coughed it up by just rubbing the lungs like that. And it comes to mind again, and I'm here again with my stories, but one lady in Wales, she was a teacher, and she had a horrendous condition in her lungs. And in front of the class one day, I worked on her the way I'm explaining it to you now, and she coughed up half a cup of mucus as easily as me rubbing those feet.
Interesting.
Quite remarkable.
Interesting. Fascinating stuff. Fascinating stuff.
It's hard to believe, isn't it?
It is.
Well, I've got some pictures here, and besides showing you the pictures, I'm going to tell you what these feet are showing me now that I'm looking at them in this vein. I can tell you by just looking at these feet what's going wrong, so I'm going to digress with telling you and explaining how you read the feet as well. Okay, so now I'll be working the lung area, and what you do is you do a little, I'm going to use the pen again, because what you do is you go up here, do this, like little, and then it's like a patchwork quilt. You go across with some walking, and that's how you do it. And then we also do what I explained to you is rubbing the fronts and the backs. This lady that's here, I'm going to tell you a bit about her feet. I hadn't thought of this until now. This mark here, you see it? All right, that's telling me she's got acid reflux. You can be almost certain she's got acid reflux by seeing that mark on her foot. So I would.
What is that mark? Is it the redness there you're talking about? I mean, what?
Yeah, the mark is like. Let me take these off, and I'll explain what I'm. I'll take it off, and I'll show you what I mean. Here, there's a little crease. It's quite clear here on my pictures, and there's a crease there. And as soon as I see that crease on someone, I know there's a digestive condition going on, and that it will give me the idea that there's going to be acid reflux in this person. And many times I've said this, the person may or may not have gone for an x-ray or the doctor, and they've told them acid reflux. That's what it is. The reason why I'm saying that your feet are like they mirror your body, and they mirror the imbalances. And so they tell the reflexologist, and everyone I train, they get to learn how you're going to learn what imbalances are going on in the feet. That redness there on this heart area tells me that there's significant respiratory conditions that affect this heart. Now, it can be the emotional heart too. Not always the physical heart, but eventually, as we all know, if you're into holistics, it will become a physical thing. And there I can see that redness is showing me a story right there. Let's see what the next one. Okay, now then, this is the diaphragm area. And this particular part of the foot is worked a number of times during one session as one is learning, because we do the diaphragm for a number of the systems that I teach in school. When we work that diaphragm pressure, then the breathing is a lot easier, and of course they've got more oxygen going into their lungs and their heart then, and the tension will go, because usually they feel pretty tense in the diaphragm area, and then they literally feel a relaxed situation. I literally do it as they're sitting in my chair when I'm working on them. When they go away, then they feel a significant change in their breathing and can breathe deeper, and that in itself will really encourage. I'm looking at these feet. Would you like me to tell you a bit more about what I'm seeing on these feet?
Please.
Okay, I've noticed this one now. There are the lungs. Oh, let me put the pen up. I love this pen. Let's do the pen. Right, now then, this is your lung, okay? So that's telling me that the lung area needs working. It's affecting the heart there. This area here is telling me she's not sleeping too good, because that's the pineal gland. See? That's telling me, now that's not working efficiently. And underneath here is underneath the occipital. She's going to be having headaches. And sure enough, that's what that client would be having. Isn't that hard to believe? Isn't it quite something to believe it, though?
Is what now?
Okay, it's quite something to believe this, isn't it?
It's a stretch, I can tell you that right now.
Is that well, I got 30 years experience with a lot of success. Oh, well.
Wow. Wow.
Here we go. Here I'm doing the spine. I'm working on the spine on this lady and going along the spine and feeling each vertebrae. Each vertebrae will be felt by a reflexologist. And then I teach that you not only do the vertebrae, but you're going to be doing, this is where you'll find down underneath there, And then you're going to have the muscle under here. Well, now, when we want to help someone with a lot of backache, we're going to need to work the muscle, because as we know, the muscle pulls the spine out. It's the tension in the muscles that pull the spine out, as well as other things. So you work on those muscles, then the spine is able to relax. So we get a better situation within the body, and then it takes over with equilibrium, and things change completely. That's one of the most important parts of reflexology, is the spine and the solar plexus. It's very important, because you're working on every single thing when you just do that. This is the working on the top of the foot in the chest and breast area. That's what I would do. Now, I'm going to do this again because I can see these feet, and I can pick out something that I could share with you. Now, do it right here. See these little bulges there, and there, and there. Telling me this lady's had a lot of dental work done.
Dental work?
Yes, dental work.
And she has?
Those areas relate to the teeth. Sometimes it's cosmetic, and sometimes it's cavities. And I think this lady, if I remember rightly, told me she'd had about 12 done.
Wow. I
said, you know, look at these toes. There's a dental area right here.
For a black person like me, my guess is that it would be more difficult for you to notice such things, right?
Oh, no. Oh, no. Some of my most amazing experiences have been with African American people, anybody that's got a different texture to the skin. I can assure you, one of my wonderful therapists is from Nigeria. Recognizes your name, by the way.
Oh, really?
Absolutely does. Would love to talk with you and meet you. She's amazing therapist. And so working on her, you can really help her immediately. It doesn't. And then I have another girl who helps me to teach now. She's got a similar tone to her skin. Brilliant. I've only got to touch her, and she's really doing well. She helps me to teach at this present time. So it would not make any difference, but I do find that people who trust my hands will obviously react easier, but it doesn't mean to say I can't pick up what's going on.
So, I mean, because the reason I said that is because sometimes you see color discolorations in the skin, and my thought was that it would be more difficult to see color discolorations in a black person's skin.
Oh, it's there. It's there. It's absolutely there. I can assure you, I work on a high percentage of people who are African American.
Got it. Oh, okay, that's right.
Of all races, I work on people, so it matters nothing. I can still feel it and see it and work with it. Can I just mention this right here too? Let me do this pen again. It's a brilliant little thing. Now then, round here, you see we've got the ribs, okay? I was working on a lady some months ago. She's African-American, beautiful lady, teacher and all that. She's about 80-something, she was, in her 80s. And I said, I can feel something in your ribs here. Has anything ever happened within your ribs? Because I can literally feel the sensitivity in those ribs that has been there a length of time. And she said, no, I haven't got anything wrong with my ribs. And then she said, but you know, when I was 3, there was a car accident and I got jolted. I think I did something to my ribs. So that memory was still locked in there for me to be able to pick it up.
Wow.
She believed me. She said, oh, look what you just found on me. Yeah, and she believed it. Okay, so we go to see what we're going to do next. Okay. This is a lady that, she's been coming to me. I mentioned to her last time. She's been coming to me for 11 years. You know, I did ask her to give me an idea of what a been good for her to come. And she said, well, and she reeled off so many things. I would have to have a number of slides in order to be able to write down what she told me I'd helped her with over the last 11 years. And of course, she's a huge advocate for reflexology and anything in natural healthcare. And then what she did, she got her family involved, and this is the lady I was mentioning before, whose daughter wondered what in the world her mother had got into, because, you know, it's the same as the story of Prince Charles going off there into something weird. And people wonder what's going on. You're working on the feet and you're getting somebody better. That doesn't make any sense. Not until you actually see the benefits of what can happen. And there's many times that she's come and we've worked with her. In fact, she was in today. And we worked with her and helped her get back on track. And then she'll come back and it'll work again. So that's a really wonderful story. Now, the hands and the feet, as we mentioned earlier on, they've got a relationship too. So you asked about anyone who had amputation and things like that. Well, that would obviously be a time when you'd start working on the hand. And there may be that someone has athlete's foot or an inflammation, and even things like eczema, such as that, when you would avoid working on the foot. So what you would do, rather than send your client away, you would work with the hands. And then other times people are embarrassed. They never have their feet exposed. They don't want people touching their feet and all this kind of thing, but they can have their hands worked. Does it work? Sure it does. On this chart showing you where these points are on your hand. So you would work in a similar vein, you know, and lots and lots of people are having sinus conditions. And so then you're going to be working all around here and there and there and there and there. And you will feel all down here, all down in here, you'll feel tiny little crystals, because the allergies are pretty bad and they're not getting rid of them. So a reflexologist can just rub those crystals and disperse them, go back to the bloodstream, flush them out with a lot of water, and they will feel a lot better from it. One lady told me after 10 years, I hadn't seen her for 10 years, and I did this on her feet, worked her sinuses, and she said when she had left me, she coughed and got all sorts of mucus out, and that was the end of it. But that's a rare case. I hadn't seen her for 10 years, but she told me what had happened.
She never had allergies again after that time?
No, and she coughed up all the mucus that was there in one shot.
Wow.
I didn't know about it for 10 years, as I mentioned. I hadn't seen her. I'd moved away, and I happened to see her one time after that. But it can happen. As you're working on them, you find that their eyes may start to stream. They might start coughing. They might even lose the mucus there and then. But they certainly would start to feel a difference in the sinus area. Absolutely a difference. And then, as I talked about, Sue was another lady who's one of my therapists, and of course she couldn't go to the bathroom on the plane as easily as you do when you're down on the ground, and thought, well, what could I do here now? And then she remembered what I had taught her about her colon, and she worked it backwards, and there you go. She prevented herself from running to the bathroom all the time. And, you know, I was with people in a huge room with over 1,000 people, and then this lady who I knew came and said she got toothaches. I said, well, come and sit by me over the lunch break, and I worked a hand. Sure enough, it helped the toothache. And that lady is now my daughter-in-law, and she's the one that put my chart together for me, so I've got to be so appreciative of that.
Wow, looks like that paid off, huh?
Didn't it then? That did pay off. Okay, now then, kidney stones. Here we're talking about the kidney stones and other conditions of the urinary system. So people go down like a ton of bricks when they've got kidney stones. They can be a strong man, they can be a child. Well, no, you wouldn't have a child having kidney stones as much, but it can be anyone. When that stone goes from the kidney down the ureter, there you've got renal colic. And so I can usually feel that stone in the ureter. What I normally do is I'll work that ureter, touch it, work it, help the stone to go down, but I'll also work the pituitary gland. The reason I do that is because that will release the endorphins, and that will help with the pain. So we've got conditions such as, you know, when people have nephritis, Bright's disease, kidney stones, arthritis, all these kind of things. You do what I suggested on the chart earlier on, when you work down the kidney, thumb off the ureter and go around the bladder area. That will change incredibly. I also like to put my thumb onto the kidney, pull the foot onto it. We call that a pivot on a point, and that will recharge that kidney and help. And that's been done numerous times in my clinic and in school.
What do you mean by recharge? You just...
Well, you're recharging because you get rid of the imbalance in the body where there's no energy running through. There's no energy running through when there's a situation like that. So you need it to have energy going into it, and then I call it a little recharge, like a bit of a battery situation.
Mm-hmm.
But I've done it so many times with so many people that have got situations with kidneys. Yeah.
Hmm.
I was wanting to show a couple of pictures of me demonstrating how back pain can be alleviated, you know, and hips. And this is what I do, work the spine again. That is an invaluable thing to keep doing. Even if your hips are out, you can still work the spine. I'm going to show what I do about the hips down here. I work down this side because this is the outer part of your body, okay? And I will work all down there. And then right in the ankle area, I would press into the ankle area, right underneath, to help the hips. And so often, it just pushed them into place. Sciatica is horrendous pain. And this is where the sciatic nerve goes, this round like this. So what I do is I work along here. Obviously, you do the spine as well, but I work along here. Then I will hold this point and this point, hold it for the length of time. And I've had people in sciatic pain for 5 weeks walking out of my office with no pain by just doing that.
Really?
You're releasing that sciatica, and yes, I've done it many times.
And how long would a session like that for sciatica last?
A session with me lasts an hour.
You mean, did you say less than an hour or 1 hour?
No, 1 hour. It will last an hour for me to work on someone, and that's what I normally do give, an hour's treatment. And then, because, you know, I work all day doing this kind of field. But with an hour, most of the time I would recommend they come back in 2 weeks or 1 week, dependent on the circumstance, dependent on the condition that they're presenting with. Mm-hmm. They may have to have more than one session, but there's been lots of times when they've walked out with sciatica without any pain. Without pain, they've walked away. And then, of course, what they do is they put in their hands on their toes and bending over, showing me how great they are. And I tell them, you know, that's not the way to go. You want to keep steady now until it all, you know, settled down. But it can happen. It really can happen. And I think that's an invaluable thing that reflexology can do, too. Because, you know, when somebody has not worked for 5 weeks, the problems in the family are quite intense, you know,
right,
because of the pain. And I remember a chap coming to me in Wales, and I worked on him. He'd been out of work for 5 weeks. And at the end of the week, he was dancing in his, wherever he goes dancing. And his friend said, well, I thought you were sick. And he said, well, I went to this woman. She worked on my feet, he said, and I came out of there without pain. And they said, worked on your feet? And he said, look, all I know is I went in pain and came out without it.
And that's that.
And his wife is now a reflexologist. So isn't that fantastic? You know, you win them and you get them. Oh, I want to learn this, I want to learn that. And so, you know, you get that situation going on too, which is wonderful for me because then they know this works and they want to use it with their family and help, you know.
How long does it take to be a reflexologist?
In my school, it takes 6 months, and this is the way it works. The students come in 1 weekend a month for 6 months, and then when they go away, they have to find 10 people and work on them 4 times and document every single thing I teach them each month. So by the end, they've done numerous hours documenting on the clients and proving they know what they're talking about. And then at the end of it, they get exams. I do a practical and a theory exam on both anatomy and physiology and reflexology, because they could never do this job unless they knew anatomy and physiology.
Mm.
So it's a short span of time, really, but they learn a lot in each weekend, and they go away, do the job, and then by the time they come back, you see, at the end, they've done 40 hours away from school. But they've also learned numerous things along the way and documented it, and that's why they get 250 hours off me for their coursework.
Right. Interesting. A question I was going to ask is this. Have there been studies to maybe before reflexology and after reflexology, maybe let's just use you mentioned the pineal gland, for instance. So the pineal secretes certain hormones.
Right.
Can't remember. Is it melatonin or anyway? I can't remember.
Melatonin, that's right.
Melatonin. Okay. Have there been studies to show whether there has been an increase or decrease in certain chemicals after the reflexology session? Or, what has been found out about what exactly?
Yeah, they have. Sorry, there have been lots of studies. I don't have them to hand, but I do know that there are numerous studies that I can present if they're needed to show how the person changes, you know, how the change comes about. Well, let's go back to the point of where that hard, calloused part is on the pineal gland on the toe, on the foot. When that's functioning efficiently, that goes. That hardness goes. There's no callus there anymore. And that gives proof that that's functioning more efficiently.
Mm-hmm.
And it's the case with every part of you. If your shoulder's off, you're going to have a callus on the shoulder area of your foot. So when you work the shoulder area, then you got the release, and then the shoulder area does not have a callus anymore. And it's just the same as the base of the heel. When you've got a situation where that lymph is stagnant, you work it, and the heel becomes more clearer. You don't have that hard, callous look or feel about the heel of the foot. So there are lots of research done about it and proof that it works. I don't have it all to hand, but I can put it together.
That would be interesting.
Yeah, yeah. Okay, so should we go? Can I hear? Okay, now this is my favorite. Success is when I help people with infertility. I think I've talked to you about this before.
Yes.
And lots of my students have helped people to have children. Lots of them. Some has got 10. Sarah, the lady I talked about to you earlier, who's from Nigeria, she's got one. She's got the picture of it in my school. And, of course, they bring them babies back to us to work on them because they're a bit precious to us when we manage to do this for someone. So here we go. Here's Sarah. Well, her little boy was scheduled to come on the 19th. Well, we saw him born last Thursday on the 4th. And I was with her during the delivery, so that was pretty exciting and special to me. And she can't stop looking at that baby, and her parents from South Dakota came down, met me, and said, well, reflexology works. So this lady could not conceive for 10 years, and she doesn't mind me talking about it.
Wow.
And then now this is as far back as I've been helping, and these beautiful children right here were helped. And their mum, I mentioned previously, their mum was the lady who wondered what her mother was getting into. And of course now she's a brilliant therapist. I mean, she really is. She's been through school, done a lot of my courses, and internationally certified. And these little children right here, I've worked on them since they're born. So they're special, obviously, to us. They come to us as if they're coming home. They become part of the family, you know. It's really special thing to be able to do for people.
Did you? So there's really no limits, age limits. You can work on babies.
Oh, that baby that was born to Sarah last week, I worked on him 4 hours after he was born.
Why did you work on him? I mean, was there a problem you wanted to solve, or what's going on?
Just wanted to give him a little treatment. Just wanted him to know my hands. I did the same to these little ones right here. And I've done it to my own grandchildren. My own grandchildren have been brought up with this field, you know.
Do they? Well, I mean, again, they it's not like they have any problems. So what difference do they feel after you've worked on them?
Well, children get problems, you know. They get stuffy noses and they get tummy aches, and sometimes they get constipation. Sometimes they get a little infection in their lungs, and all this kind of thing goes on. And sometimes they're just overwrought and they need to be worked on, so I work on them. My daughter, who's a therapist, she does it to them too, but I often work on them. They got used to it. They've been brought up with it, so they don't know any different, really. But when you've got the children at this tiny age from babies, that helps the whole change around from just taking medicine for a condition that can be handled with just a reflexology session. It's quite an amazing thing, and it's really rewarding to be able to do.
Right.
You're quite quiet there now, David. So.
No, just thinking. Okay, that's great. Yeah, I'm following.
Okay. Now then, here we've got the stress condition again. So whether we've got a serious imbalance or we're just overstressed, you know, what's going to happen is eventually a health condition is going to manifest itself one way or another. The way that we think, as you mentioned in your introduction, the way we think, what is going on in one's life, the food we eat, the pollution, all these things have all contributed to whether we've got a serious imbalance or not. And having a reflexology treatment has got many, many people back to a condition where they won't present with a serious disorder, because we bring the stress levels down, and then the person who's receiving will really benefit because they are now at a level where they feel less stress, and the body has a chance to heal. Body doesn't heal when it's not relaxed, and it can do that. So did you have any more questions, David?
No, right now. That's good. That's good.
Okay, so I think we're coming.
Are you there?
Okay, I'm just giving you a thanks here, and on my contact site. So I'd be happy to go back to the chart and show you more things. If you'd like me to do that, I'd be more than happy to do it.
That would be great. Thank you. And folks, you can start sending in your questions so we can deal with them as they come in. And I just want to say that this again, Patricia, this has been a fascinating study and exploration. Thank you so much for putting this together. You're a wonderful person to interact with because you're so charming, and you take my some of my antagonistic questions very, very well. So thank you.
Oh, they're good questions. They were good questions. I'm going to go back to the chart, but I've got to go back, okay?
Well, here's what you can do. Click select go to slide. that's two steps. Yeah, to do that, and then that should be able to you should be able to find where the slide chart is from that.
That's perfect.
Number
Thank you.
17. There you go. All right.
There you go.
All right. Now, folks, this presentation, one of the reasons I like this is because one of my passions and my goals in life really is to understand how the body works and to obviously show people how the body works. And this presentation has really shown just how amazingly the body works and how things relate to each other, how everything just connects one with the other. It's amazing. You can read the body from the foot, for Pete's sake. Next thing, our iridologist will be telling us that she can read the whole body from the eyes.
Yes, you can.
My goodness, this is amazing. So again, thank you so much, Patricia. This is great.
You're welcome. You're very welcome.
All right. Is there something you want to talk about? Okay, someone says, what was the website? Patricia, you want to just say it out again?
Oh, yes. The website is www.derwin-therapies, DERWEN, therapy is all one word, .com. I can put the chart up if you'd like me to. If you'd like me to put the slide up. That's the website, and as far as I know, we've got this chart up on the website so that we can, if anybody's interested in having one, they're more than welcome to buy one off us, you know.
Mm-hmm.
But it does give you a good indication of where everything is and where the relationship is with the nerve endings and where it is in the body. It's not random. Nothing ever is when it comes to the body. So it's a pretty fascinating field.
Right. Are your foot charts for sale?
Yes, they are.
Okay. What's the price?
The price is $19.95 plus postage and packaging, and I understand it's tax too. But I don't buy that kind of side of it. But that's the price that the chart is. But it's a pretty big one, isn't it?
Yes, it is. I like it. It's very well done. I would have to say. I just need to find a way to make it flat now because it's all rolled up like a scroll.
Right. We've got ours in a frame in the office. But what's so wonderful is that if one does practice any kind of natural health care or any other kind of health work, then having a reflexology chart in their practice is a good idea because people will be drawn to it and see what could be what with their bodies, you know, and they will start looking in terms of, oh, my left foot's hurting on my spleen area, I think I might be going down with a cold. You can prevent it, you know, by working the spleen or something.
Mm.
It really does help because I know from my own personal experience, that's what I do. If I walk around barefoot and it hurts me on a certain area, and oh, my spleen's off today. There you go. Oh, there you go. My liver's doing something to me today. That's how it works, you know. But I've become so used to it. It's like breathing to me to know this work. To work with reflexology is like breathing and holistically thinking, you know. I holistically think of how the body could have become imbalanced and the emotion we've experienced because of your liver or your heart or any of those things, or your back even. You know there's an emotion that's triggered this pain off or this imbalance off, and that is what I teach my students, and they go out and able to use it.
Yeah, but Patricia, let's be quite frank here. I mean, if you work on the foot for a back problem, I mean, the back problem could have the muscles could be out of balance. They could be, it may work to reduce the pain, but would the muscles and the bones, would they stay after you worked on them? I mean, it doesn't reset or realign those bones and muscles, does it?
They can do. They can do, but we have to remember why did the backache come, you know? It could be an injury. Very often it's emotional. And then you work on you have to work the entire spine a number of times and get rid of those imbalances and sure enough, they can go out and it can last up to 2 weeks with no backache, and then maybe even longer. It depends on each individual. But unless you really relax those muscles in the spinal area or in the back, your spine will go out again because it will be pulled. So we have to work on those muscles in order to be able to hold it, you know. It makes a lot of sense to me. I don't know how hard it is to believe, but you know, it's I've done it many times, and so it works. It literally works, and it's hard to accept that until when, you know, at this moment of time, chiropractors are used in reflexologists in their practice. They are. I've had some therapists that I've trained go into chiropractors' offices to work there and help with reflexology. So it's becoming a popular thing to use in conjunction with other therapies. You know, everything works. I believe everything works.
Okay.
Not just, you know, I really do believe that. I believe everything works. Whatever we do will work. Will work for us. And we can use a number of complementary therapies in order to bring equilibrium to a person. And it's the most important thing is that that's what happens, not just insisting that only reflexology can work. Because aromatherapy works too. I use that all the time. And so does raindrop therapy, which I use. And that's when you see me straighten the spine, when I use the raindrop, with the oils that I put together along the spine. Takes away the bacteria and the viruses that lie dormant. Then you've got a release, you know. So it.
Wow. All right. So, I'm sorry. I didn't mean to interrupt you. I was just okay. Well, someone says very informative and clear slides with great dialogue between Patricia and Dr. David. Many thanks. Question.
Oh. Yeah.
Are calluses caused by ill-fitting shoes?
Oh, you have to accept that I've got to tell you what I believe, okay?
Okay.
I don't think calluses are formed by ill-fitting shoes at all. I genuinely believe the calluses are there because of an imbalance in the body. And ill-fitting shoes or new shoes will rub because there's an imbalance in the body, not because they're new shoes. That's my experience over the last 30-odd years. But if someone doesn't want to accept that, I'm okay with it too. But I really believe that the callus is there because of an imbalance in that body. You bring balance back to the body, the callus is gone.
Even if the person continues to wear the ill-fitting shoes?
Sure does, yeah. Some people go and get pedicures before they come to me and get all those calluses shaved off. And I can still see the imbalance. And I say, do you know what? This is all going to go back until we get balance back into your body. It's all going to come back. You can take them off as much as you want, but that's what's going to happen until we bring this balance back into the body, get this energy level running more freely and efficiently, and that's the only way you're going to get rid of them.
Well, a couple more thank yous. A question says, how can you treat an ingrown toenail?
Well, I would start off, I very rarely start off by talking to my clients about the emotional reasons. So maybe if they trusted me enough, I might just share that with them. But, let's look at it like this. Your ingrowing toenail, okay? So I'm going to show you where the hypothalamus is. Here. Okay? So all of this toenail is going to be creating a disturbance here, all along here. This is the jaw right here, okay? So we're going to have the hypothalamus there. I would work all around here and go to the jaw. Very often the jaw can be dislocated or you could have TMJ. So I would get that worked on right there. And this is the face. Then you go down here, down the vagus nerve and the trigeminal nerve. So all this would be a part of the work that I would do for them. Does that answer the question okay?
Yeah, I'm sure it does.
Okay, all right.
All right, Sue wants to know, the toes of a friend's left foot are badly twisted. He is a Vietnam vet, suffers severe PTSD. What do you suggest, Patricia?
He has what? I beg your pardon, I didn't hear that.
He's a Vietnam, the toes of a friend's left foot are badly twisted. And he also suffers.
Soles of his feet. The soles of his feet?
No, the toes. Toes as in fingers, toes.
Oh, gotcha, toes. I beg your pardon. Yeah, okay, the toes of his foot, okay. That's, oh, well, this would explain the whole situation right here. Because these toes, right, let me get the pen again. Get the pen. Okay, here. Is this what he's talking about, you think? This area here is sinuses and the brain. Okay, that would be affected by anything to do with a chemical situation. And they could be worked on, actually. They could be worked on. Now, it doesn't mean to say that the person won't be sick after, because they'll feel as if they've got flu, because that's a healing crisis. But I certainly know that you could work all the area there and work it and there will be, I can assure you, there will be crystals inside here, like sugar grains, maybe they're bigger than that. And they will be released, and eventually the toes can change, and they do change when the body gets balanced and the energy level is running through. Absolutely, I would definitely work on that one.
And would that help with his PTSD as well? PTSD is a post-traumatic stress disorder,
Yeah. I'm hesitating with that because I know that I could, I would definitely say, now see, this is the brain area right here, okay? So that would need to be worked. Let's look at this. Here is the center. Let's do the longitudinal zones again. That's the brain. And what I notice with anybody with such a condition and depression and everything, the callus will be on the top of these toes with him, okay? And then it will go down here. It'll go down to the eustachian tube, through the lung, through the solar plexus. This area here of your colon relates to the heart discordance, small intestine, and down the sciatic nerve. So this entire part right here would be affected by him, for him. It could definitely be done. He would need a few sessions, but could definitely be done. I would definitely work on a person like that, definitely. And I would be expecting results, positive ones.
After how many sessions?
Well, my recommendation is that you have 7, 1 a week for 7 times, and then see the change. That's my recommendation. It doesn't always go along with the person's purse, because sometimes they wouldn't be able to afford it, and sometimes they wouldn't be able to come because the time and money is everybody's situation. But that's my recommendation. Having said that, it would be better for them to come every 2 weeks or every 3 weeks for a length of time. But I would not feel that could not be helped. I really do feel that it could be helped.
Well, then again, Patricia, you believe that everything can be helped with reflexology.
Well, not only reflexology, but holistically thinking, you know. I've seen it. That's why I've got so much trust in it. But
Right.
it is a holistic thing. And working on the feet, it is amazing how much people will divulge has happened to them, how they will then recover, because we need to talk all right about what we've gone through in order to be able to recover. So it's a holistic way of thinking, really.
Right.
But I do genuinely believe that these things can be helped. I really do believe that.
Can it help with inner ear infections and problems?
Right, I'm going to get my pen back. Okay, get rid of this. All right, inner ear. Okay, so lots of people are told that when they've got Meniere's and tinnitus and all this kind of thing. They can't possibly get rid of it. They've got to live with it. Okay, this is what I would do there. Oh, let me get my pen. Uh-oh. This is what I would do. First of all, I would ask them how much dairy produce are they eating. Right here, I would definitely find a really hard piece going along that area right there. And it's going from the outer ear and the inner ear, which is here. And this is a mucus buildup. That's all that is. So when you get that kind of a condition coming in, you work along it, and work inside the inner ear and outer ear until you can clear what's there. And again, that brings a lot of rewards because it really can help people.
Okay, well, listen, this has been fantastic. We are going to have to wind down very soon. I'll just take one or two more questions. I know the questions keep on coming in, so I'll have to just pick one or two. I actually had something from Bev. Bev actually sends an email saying, Sherry, these are my two grandchildren that Patricia is showing. She gave them reflexology when they were born. Remind Patricia that the children that do not come through the birth canal, that is C-section, have some of the fluid in their head that is not pushed down into the spine. So I guess there's a problem with that. Another thing is how she helps with the terrible staph infections that people are dying from. She cured. All right. She helped my daughter with the staph infection. I like to stay away from the C word. She can tell when someone is pregnant before they even know. My grandchildren recognized Patricia's voice after they were born because they knew her voice from when she worked on them, on the mom, before they were born. By Bev. Isn't that something?
Well, she's a fan.
Apparently.
She's a fan of mine, and they like family to us, you know. And there are lots of things that we've done, together. It is true, and of course, the medical field is now realizing that when you talk to an unborn child, they know your voice, and they did know my voice, and they've known my hands and known me for as long as they were conceived, because I was helping situation, and yes, it's a wonderful thing. And because of the staph infection that her daughter had, you know, that's why she came to me, and so that's why she got these children, and that's how we've become pals, and she's gone through school, so she's a big fan of mine, so I really appreciate her a lot. There's a lot of people out there that are thrilled with the work, and have been coming to me for a length of time, and I appreciate Bev writing in and telling you about it.
Mm-hmm.
Oh,
yeah, that's fascinating. Fascinating. Okay, well, I can't end this without mentioning Anita's question, because Anita Lewis obviously is the one who helped connect.
Oh, yes. We got a lot to thank her for.
We sure do. We sure do. So here's a question. We'll wrap up with that. Can your work help people who have carpal tunnel risks?
All right. You definitely can. And this is one of the times when you might just choose to use hand reflexology. Okay. But this is what I would do. I've got my little pen out again. Here you go. I would go down here, which is the arm. Okay. And I'd go all the way down this, because this is the outlet of your body. But I would clear all the pathway right here. And I would also go onto the hand and work the hand area. Now, where we would work on the foot is around here, which is the lymphatics and also the fallopian tube. And I would work all that. And then I would work down the arm, both sides. So I would literally be working with my thumb walking, caterpillar walking, all the way down each side of the arm. So it certainly can, but then holistically, I would then talk about the emotional reason why that came initially. So that's another side to this work that I do. But I certainly would go all the. I can be sure that this area here has got callus, right there, got callus. I had a chap in not long ago, and I said, "What's going on with your arm?" It was over this side. I said, "What's happening here with your arm?" And he lifted up his sleeve of his shirt. There was a massive bruise on his arm, and I picked it up right there. So, but Anita, it's wonderful that she's called in, because she's the reason why we're doing this. You know, it's wonderful.
That is true.
I have to thank her for it. And she's been through school. She came through school, and she's an ITech certified reflexologist. I tell you, and she's brilliant.
Well, she is. She's on practically every one of our webinars.
Yes, I know. I heard. She encouraged me a lot after the last situation I had.
Last situation?
Yeah, the last time when I looked, well, there you go. We won't talk about that. She really, really encouraged me. She really did. So I was pleased with her for doing that.
Well, Patricia, we're going to have you come on for several more. We really appreciate the time you've taken to share this wonderful, fascinating information with us.
Oh, well, thank you, and thank you for giving me the opportunity.
And who knows, I may see you in a couple of weeks, because I'm going to spend some time with my brother in Houston for Thanksgiving.
Oh, well, you must come. I'll give you a treatment, and we'll see if it works.
Absolutely. Bingo. There you go. I'll prove it for myself. All right. Well, thank you again. And folks, thank you for joining us. And be sure to see us next week. We have quite a few. Oh, by the way, tomorrow we'll probably be sending out emails on interesting point. The dentist in California, they found out that dental amalgams aren't the best for your teeth. As a matter of fact, they are trying to pass a ruling to ban the use of dental amalgam by dentists, because they're finding out it's causing all kinds of major trouble. We had a dentist actually do a presentation, show all the slides of pictures of his patients who had dental amalgam and the damage that it caused in their teeth and their gums, and how that even relates to systemic problems like heart disease and brain issues and all that other good stuff. So that would be something you would like to look out for. You can watch it over the weekend. All right, this has been great. All right, so Patricia, we'll be talking later. Thank you again. Have a great rest of the day and great evening. God bless.
Well, thank you, and thank you for the opportunity. It's been wonderful.
Thank you. Thank you very much.
Okay.
Enjoyed it.
Bye-bye now.
Bye-bye.